This is a Geek Leader. Hey, Geek Leaders, welcome to episode 130 of a Geek Leader podcast. I'm your host, John Rauda, and today on the show we've got Nader Mherabi. He is the Chief Information Officer, Senior Vice President, and Vice Dean, responsible for all information technology activities at NYU Langone Health. And we talk a lot about healthcare technology. We talk about the digital transformation that is going on in healthcare. A lot of the things that I've always complained about whenever I had to go to the doctor or urgent care. We talk about how NYU Langone is fixing these issues, and it's an awesome conversation. You get to find out a lot of the transformations that's going on in healthcare. We talk about some of the leadership aspects of how you bring people along with these transformations. We talk about some of the cool tech, with AR, AI, virtual reality. We talk about all that stuff, robotics even, and how that's helping with surgeries and other kind of healthcare. It's fantastic. A wonderful conversation, and with all that being said, give it up for Nader Mherabi.
Thank you. Thank you for having me.
So just to lay some context and some background for our listeners, can you tell us about how you got started in technology, where your journey has taken you, and kind of what you're doing today?
I have a computer science background, but I've been interested in technology from ever since I was a teenager. My mom bought me my first Apple II computer and an original IBM PC, which I got rid of back in 1996. So
wow.
I held on for a while. But I was interested in initially in coding and design. Initially, I wanted to be an architect, but then my sister convinced me that computer science is a better thing to major on, and so I in a way, and now I think reflect back, architecture is inside when you create something thoughtful. It is inside your entire system, but it's not as visible as buildings are. But for techies, you know what I mean. When you have an architected environment, or when you design a solution really in an architected way, you get a lot more satisfaction because with architecture allow you to really have your flexibility. Just as a great building, it grows with you, and it's got an afterthought to it, so it's plans for the future. So anyway, I have been in this space for 33 plus years, and grown through the rank. I've done many roles and jobs from mostly on the application side, from designing application to actually managing them, and then leading people all the way here. I was in the financial world for 12 plus years, and then in health for past 20 years now, almost. But it's been a very enjoyable ride, and I love what I'm doing, and I'm passionate about what I do.
Excellent. One of the things we've talked about a lot on the show, we've had several people on that talked about digital transformation. And my company where I work full time, we've actually are still in the process of going through a digital transformation in our industry as well. Has healthcare been affected by the wave of digital transformation that's been going on?
Of course. I mean, healthcare is a prime. And it's ripe for digital transformation, I feel, and it has been for some time. But as you know, digital transformation means different things to different people. But for us, it's something that we really we can't. Institutions like us cannot survive if we don't transform ourselves to that level of digital and efficiency and connecting with our patients and consumers and families. So it's really a big shift for us to be competitive and provide the best service to our patients and their families.
So what does digital transformation mean to healthcare? What can you define digital for you?
So there's many aspects. The first aspect is really the way the organization functions, and it is difficult for taking, for example, organization like us, 150 plus years in providing care to the community, to transform and think differently, as opposed to when you when you think of a brand digital company like Amazon or Uber or you know Google, we're just this. It's the foundation is designed digital. So it's you have to think about the different path taking to get there. So for us, the first foundation was really how people work within our own institution, and it used to be that yes, you have technology, but it wasn't truly digital because then you worked through technology system, but then it resorted to paper, and then the information from paper went back to the system. So it's about designing seamless workflows so that's truly designed to take advantage of a digital architecture and systems, such as just as Amazon would do. They don't print the requisition paper for people to fill in the warehouse. They actually, you know, the same orders go to the robots or to the people right in the warehouse and get fulfilled, right? So there's no touching and transporting and transposing information back and forth. So for us is that part of it. And then the other part of digital is really how we can put on the palm of consumers, patients, and their family the power of engaging with us with one click away, being connected with us through the digital means, which is really a factor of convenience, a factor of a better communication, and serving the patients ultimately and their families in a much better way. And that ranges from how quickly can make appointments, find us, learn about our great clinician, to really engaging to a telemedicine session with us, or if you have sitting at home on a Saturday morning and a child is sick and you actually don't want to go to the emergency room but really want to talk to an emergency doctor, we just one click away. We can actually pick an appointment slot of 15 minutes and engage and see our board certified emergency physician on with your phone.
So I had a question about that. I don't go to the doctor very often. Luckily, I mean, at least not for being sick, just for checkups. But I did. I guess I got the flu or something a few months back, and I went online to look at my local healthcare provider, and I noticed that there was a button on there that said schedule a virtual appointment. I didn't do it, but I was curious of what the back end of that looks like. Is that do you have medical personnel that their only job is to do digital or virtual appointments, or is that like they rotate in and out from? Is that just a normal schedule for someone, or how does that? I just have no idea how the back end of that works.
So it depends who you engage with. Different healthcare providers have different models. So some model totally outsource it to a telemedicine providers, right? So like Teladoc and so forth, where they provide the technology and the doctors. Some of a model where the technology is a third-party technology, but the doctors is theirs. Some of a hybrid model where the technology is somebody else's, the doctor is theirs, but when during the surge or they don't have the capacity, they can actually sort of send you to other third-party doctors. We have taken a different approach. For us, is technology is ours, is embedded in the way people work. So we're not making doctors to jump to another technology to take care of you. Also, your chart is in one place. Second is our doctors are our own doctors. These are board certified, our emergency doctors who practice, or emergency doctors, but then sometimes maybe 1 or 2 days a month, or they want to decide to do telemedicine session. It's also work and life balance for them, because they can actually do this from their office at home if they wish to, or they could come to work and we have an area they could do telemedicine virtual health sessions. So that's how. So there are different models for that.
Yeah, that sounds. It sounds so convenient. Like just to be able to jump on and do that, and not have to. I guess I could visit a doctor from work. I wouldn't even have to take off per se. Just shut my door and do the appointment.
But the most important aspect, aside from technology, is I want to make sure that you still be seen by the best qualified doctor, right?
Yeah.
No technology is going to improve that, right? So you still want to make sure, the approach we take in ours is really board certified. The same emergency physician who practices emergency room will pick up, and then in their queue, when they're in their schedule, they can see that they have a telemedicine session that they can start. So that's how it works. That's why the importance of technology being in one place, so that we don't break up the patient care is the way we think about things, both from the doctors and for the patient.
So having it all in one place, does that help out with like HIPAA compliancy and security, just securing people's private information?
Of course, because when you can have much better focus on one thing as opposed to have when patients have when a health system has multiple technologies and bring in different vendors. So it's a platform approach that we're taking, and that allows you to really take care of the platform in a much robust way, as opposed to take care of 20 systems, right? Two different architectural thinking.
Yeah, for sure. I know the last time that I had to actually take my kids in for something major, it really wasn't major. It was just to get tubes, and we went through there, and I realized all the paperwork we had to fill out by hand, and just manually fill it out. And I was thinking in my mind, because I just recently interviewed a cybersecurity expert. We started talking about healthcare, and I started thinking, well, what happens to all these paper? Like, obviously, the person's going to type it into a computer, right? What happens to the paper? I guess they shred it or something like that, but that's an extra liability stretch. Have you guys kind of moved away from that and had direct where patients directly enter their information?
Totally, we're here totally digital, which means that when you come in, you can actually fill it all out on our app before you get to your appointment. So you get a reminder, you got a medical history to fill out, or for your kids, you can be proxy to your kids. You can actually fill out their paperwork. So you don't have to, when you come to the exam, to the physician office, you don't have, they know already you filled it out, so they won't ask you to even give it to you. But even if you didn't do it, some people don't do things on time, They're human. In the office, they give you a pad. You can do all of that on an iPad, and it just goes on our system. We really try not to get paper from you. Even if you bring something from your doctors that, let's say you were that from your previous doctor wasn't part of our system. If we take it, we scan it in our system, and we shred the documents, the original paper, because we don't want to keep paper around. So everything is in the system, digital, accessible for clinician to take care of you. So that's been for some time that we totally walked away from.
So I imagine by making that shift, you've been able to optimize it so that patients don't have to fill out the same thing multiple times. Because I swear when I was at that doctor's appointment, I had to put my name and address probably like 6 different times.
No, we don't. No, it doesn't ask you. It does ask you certain things to verify. For example, to make sure that are you taking the same meds, or your allergies hasn't changed. So it does ask you to verify that, because that's part of care, right?
Yeah.
But no, it doesn't ask you. It doesn't ask you if the address changed or your insurance changed.
Right, but you don't have to enter it on every single page of the form.
If you say no, you don't ask you, and ask you to sign, digitally. You can sign with your, on the pad with your fingers, and always you also have kiosks, a lot of kiosks, so you can come and self-arrive yourself. And we think about going with geofencing, so you can actually, when you get into our exam room, the people know you're there. It's kind of been interesting, we call it the access piece of care. It's really this all of making appointments, filling out the required, the questionnaires, and all of that is really, we want to make it as convenient as possible, because people do get annoyed when one side doesn't, the right side doesn't know from the left side, right?
Mm-hmm. Yeah, I think that's one of the most frustrating things is when you're sick, you're already in a different state of mind. You're not happy. You don't want to be there. And then you have to retell someone the same thing that you just told someone else. It's kind of frustrating.
Yeah, and it's all about the experience. We really, the way we think of is your total experience, which is both through technology, but also when you come to office, you want the office to be clean, calm, place to sit, have access to Wi-Fi, coffee. It's not that just digital. It's also physical.
Mm-hmm.
Space that has to be conducive for a patients and family to feel comfortable, because, like you said, you're under stress to begin with because you're sick, and so that's that's sort of our strategy, not to also digital but also physical. Make sure that our what we call our ambulatory practices, physician offices that are really it's convenient, it's clean, it's multi-specialty. So if you have to get imaging done, it's all there, or give blood, or all of the things that you really you have to do, it's all in one place. So one-stop shop type of think about it that way, where you don't have to go 15 places to get things done.
So you mentioned earlier about the the importance is the quality of healthcare, and I've seen some articles recently about how artificial intelligence has been able to scan, like you mentioned, imaging has been able to scan some of the MRI scans and other things and find abnormalities better
Right.
than humans can do. Is that something that you guys are incorporating? Is that still a little bit further down the road? Where does that stand when it comes to actual patient care?
So clearly, just in the overall AI, machine learning, deep learning, predictive analytics as a space in healthcare, and it's relevant for different aspects. Clearly, it can help a radiologist to find things faster, right? Or if something is overlooked, to highlight those things. Um, it hasn't replaced the radiologist yet. I don't need to be some time, but the way we see that these are great. It's a great tool to enhance knowledge, right? Because there's so much data, and it's just not that people always think that it's going to help imaging, but our strategy is going to help so many caregivers, from physicians to nurses to transport people down to maintain operation people. So we see the benefit of AI is really being a sort of a great advisor you to all sorts of workforce, where they help them to do their job much better, because there's so much information around you, and then analyzing that data, crystallizing that, finding insight for you to take action. That we think it's right now the place for us. Now, what's going to happen 10, 15 years down the road and how it's going to grow is anyone's guess. And we will continue grow these technologies, but they're very relevant. And we already have in our institution, we have over 20 models have really deployed in real production doing various things.
Have you had any partnerships with like search providers or anything like that? I think of Google because I heard a study. This has probably been a year or more ago, where Google could kind of predict rise of people getting ill in certain areas, because typically, if I'm sick and I may have the flu, I want to Google the symptoms and figure out if there's something I can do at home before I go to the doctor, maybe a day or two ahead of time. Is there any type of partnership that could be established to where you guys would know, hey, we've got a lot of people in this geographic area that are searching for certain symptoms. Maybe we should staff up some medical folks to be prepared for a rush.
Yeah, I see what you mean. We do collaborate with New York State surveillance, infectious control. We do send our data to them. So basically, the way New York State and New York Health Department, New York City Health Department, they do call surveillance. So they collect all the data from different emergency rooms and they look at the patterns. Let's say if a lot of kids showed up for measles and in a different ED room in different geographic location, then they kind of predict the outbreak of certain disease, and then they communicate back and forth. So we are much more part of city and state initiatives, as opposed to doing side deals with companies like Google or so, because it's all about population health management, and you need to really collaborate with your city, local, and the state government.
Yeah. I'm guessing that's also probably another thing to think about is the HIPAA compliancy if you did partner with another company.
Correct, correct. This is more about, and we are mandated to send like New York State data about, surveillance data about what's happening, so they can see the pattern of outbreak of a disease.
Yeah, I guess that's for like the CDC and things like
Yeah,
that.
yeah.
Okay, yeah, that makes perfect sense. Have you seen like an increased shift? I know you talked about the being able to get an appointment from home. Or is that what the percentage? What's the percentage like? Is it most people are still going in, or most people are trying to get the virtual appointment first, and then that may lead to coming in for more care later, or is it kind of just a 50-50? Well, what is that like?
So we are really driving it because we have such a great capacity. We spend a lot of time building that capacity and make it easier for patients and their family to engage with us, to download our app and to do that. And we've seen, and we really, it's not as easy as you think to, in in digital speaking world, customer acquisition, how to get people engaged to do things digitally. but we get great results. We actually launch our commercial, local commercial here. That's amazing about on the TV and radio, digital media, buses and everything else you can think of about really telling patients and consumers that, hey, that's how you can engage with us. Download our app. We make it so much easier. And we've been at it, and we're really seeing how our online appointment numbers shifting. We are above like 20+% of our total, volume, but we really want to push that to, I think last time I checked, 20 plus. But we really want to push that a lot higher. Now, you always know that certain demographic would still call our access center. But what we've done, even on our access center, it's all same technology. We've integrated technologies such as electronic health record, which is Epic, and then Salesforce and the phone switch. So it's very intelligent about how it knows who's calling and be able to really quickly help a patient, and then also redirect them back to say, hey, you can download the app. You get a text saying download the app. You can see your notification and so forth. So trying to create the full sort of a full cycle of engagement.
Yeah, that's interesting. I think I guess I'd be curious of what all you could do from a virtual appointment. I guess I've got an older Apple Watch, and I saw the newer Apple Watches have EKG, and there was ability to be able to share that data with your provider. Is that something that you see people doing as part of like their routine health checks, being able to send that information to their doctor just to make sure that their heart's still healthy and such?
We do it. We have several pilots going on for, especially with chronic conditions. People have, chronic condition that really want to be able to send that data. Now, obviously, you have to be careful about your heart EKG on your phone, because that's not,
Yeah, it's only one data point versus multiple.
Yeah, 12 lead EKG. But no, we are doing it in several chronic disease space right now. So through Apple Health Kit, and to be able to send data through our app to our electronic health record for a physician to follow. But it's much right now. We think it's much more relevant for chronic disease, especially.
Yeah, I could see that too. I could see I had an uncle that he had diabetes and he had a pump, and he said he would download the information from his pump and then upload it to his doctor. I was wondering if there should be a way to simplify that so it just automatically pushes.
And it's really a collaboration between the device provider and then the phone, which is integrated. Which we are in case of Apple Health Kit and into our app. Mm-hmm. So forth. So it's just a layer of technology that's already placed and is working. But these devices changing and get a lot more smarter, and they get in, and then also how do you decipher the data? So and make it simplified for clinician to quickly see this and then graph it. So it's just several pieces have to come together to make it really useful.
Yeah. Where do you see this going in the future? What do you think the next thing is going to be? The next transformation, if you will, in healthcare?
Well, I think technology is going to continue to play a major role in the healthcare transformation. I think the healthcare has been slow to adopt digital means and across the country, if you look. But I think consumer will push, and as it already has, at least in our market, which is very highly competitive, right? Because the New York market, New York is very highly competitive, New York City, because you have so much access, different institutions competing. We'll continue to push, both in terms of in a back end, which is think about robotic surgeries. There's so many surgeries can become robotics and continue to do that. And then also in the front end, which is really consumer and patients was the best experience and the convenience. And they will push the organization, and then it'll become a competitive advantage. We think already is, in our case already is, so that and people feel that you're one click away to get help when they need it, right? Because they don't need us every day, like in health. But when you need us, just like when you need transportation, you use your Uber or Lyft, but it's a one click away, right?
Right.
We want to be one click away because we think, patients ranging age, young patient all the way to 50s, people now are sophisticated. They use the smartphone. They engage with other industries, whether you're booking your online travel to, getting your transportation, and then your health, you think the same way. Like you said, okay, if I really don't feel like I want to see a doctor, but I don't feel good, and I really want to have a virtual session. So you ought to have that, right? You will demand that, and that's what it will shift things. And there's so much other in terms of robotic surgery and the surgery, and there's so much technology, of course, to continue deriving how we do, you know,
Is that something that you guys are doing now? Because that's new to me.
Absolutely, absolutely. We are engaged in all aspects of that, both from back end and moving the cause of. We do. Our institution is highly, of course, is a, should have a highly specialty, such as we do, liver transplant, heart transplants, kidney,
Mm-hmm.
lung transplants, even face transplant, which we've done. Which,
Wow.
you can YouTube. You'll see NYU Langone face transplant, and you'll see the amazing video as a firefighter. That was so just an amazing thing that happened last year, I believe it was. So it's a very highly specialized. So we do those, and there's a lot amount of technology used, and amazing team of clinicians we have to do that.
Yeah, I actually, I don't think I've ever said this on the show, but I actually donated my kidney like 19 years ago to my uncle, and going through that process. I mean, I'm sure a lot has changed since then, but it was very manual. And I remember I was so interested in like what was going on. I asked the doctor to actually take a picture of the kidney like, before he put it in my uncle, and he said that's the first time they'd ever done that. Take a digital photo at his hospital. This is at University of South Carolina Medical in Charleston. But yeah, I can imagine with robotic surgery, I'm sure things are so much more precise. You don't have to worry about, the cuts are probably a lot cleaner.
Yeah, and also how they test everything and the procedure, the techniques have changed so much.
Mm-hmm.
Same thing with, think about orthopedics. People go and have knee replacement, same day, go home.
Wow. Yeah, so when it comes to that...
We have in a hospital, right? I mean,
yeah. So do you guys have, or is there any use of virtual reality or augmented reality when it comes to training or help with some of the surgeries?
Yes, we see that, and we have a couple of use cases already in place, especially training residents using augmented reality. It's a great use case. Also teaching medical students. We already have some of this about virtual anatomy. So our School of Medicine is pioneer in this type of technologies. Digital anatomy and teaching people through digital means. We've really pioneered a lot of digital medical educations. Actually, our institution wrote the curricula for 3 years. We have a 3 years pathway, so you can go actually at NYU 3 years, become a physician, a doctor. We do guarantee residency at NYU if you get accepted. So of course you get accepted. You get to study.
Yeah, I'm sure that's the hardest part.
And have a great MCAT scores and all that stuff.
Yeah, well, that's awesome. Yeah, AR is just, I just thought about it when we were talking. That would probably be a really good use case to being able to see kind of the stats of what's going on while you're doing something without having to take your eyes off of the patient.
Yeah, it's usually it's used in use case of three. One is clearly to teach a resident students. Second is to reteach families. So surgeon can kind of show a patient and their family how they're going to, let's say, remove a tumor, from their brain, and should kind of get in the brain and show exactly where they are. So there's a great example. And thirdly, for surgeons to plan their surgery. So they can use this kind of virtual reality to kind of actually plan the surgery. And it gives them a better visualization. As you know, the hits and stuff has to get lighter, and the what I call the edge processing has to get better, because right now it's slow. So it has to have better, because they're working on several on fast chips and faster edge processing, because it takes a lot of images to reconstruct everything, to create a 3D model for you to see, so that it requires a lot more compute.
Yeah, that's it. I mean, I guess that's the future right there. Is once they can get that smaller, lighter, and faster, that'd be pretty amazing. Well, this has been a great conversation. I really appreciate it, and it's definitely enlightened me on some of the things that's going on when it comes to digital transformation in the healthcare industry. Is there anything you want to leave the guest with before we end the conversation?
No, I think really, since my sense is you're your listeners are tech folks. I think that it's in healthcare is an exciting time in technology. It's there's so much technology is such a strategic part of what we do, and it transforms, and I believe it already has, and it will transform healthcare. So if you're not in healthcare tech, consider working in medical technology. Come over. Just like
Yeah, it sounds super exciting. You got robotics, AR, VR, artificial intelligence, machine learning.
so
Um,
much.
It's so much going on, and that seems to be like right up the alley of most people that are getting involved in tech that are excited about it, like I am. You've got all those different technologies right there that you can just kind of pick and choose where you want to go.
Right, and plus, the cause is so novel. You're helping people, right?
Absolutely, and that's one of the big things is purpose. You got to have purpose to help motivate people and keep people inspired about the job that they're doing.
Right. But I think that's very important, right? We all want to get paid and take care of family, but we also want to come to work for a purpose and be able to contribute.
Yeah, absolutely. Oh, this has been great. I really appreciate it. How can people find out more about NYU and what you guys are doing?
Well, you can go to our website, NYU Langone.org, or you can use the media. So you go to my LinkedIn page online and LinkedIn, and then also use you'll be linked to Medium. We publish articles that talk about things that are useful for people. I'm trying to keep very high quality and kind of give, my audiences are tech folks. So we just write thoughtful articles about things that gives you information about what's going on in tech world, healthcare tech world.
All right, I'm going to link that up in the show notes to the Medium page, your LinkedIn, and to the NYU Langone website. And people can find all that at geekleader.com. And thanks so much for coming on the show.
Thank you very much. Pleasure talking to you.
I hope you guys enjoyed that conversation, and if so, please head over to Twitter and share it with a friend. Also, I would love it if you would head over to Apple Podcasts and leave a rating and review. That's where I get my inspiration for continuing to do the show and encouragement from you guys. It's also a great place for feedback. Mostly positive so far. We've had 4.9 ratings overall across all the different stores. That includes ratings from the UK, Australia, United States, Canada, and many different places throughout the globe. We've been downloaded now in 86 countries and in all 50 states, which is fantastic. Blown my expectations away. So keep it up. Share it with a friend. I greatly appreciate it. And I appreciate you guys for listening. Thanks so much.